Welcome to our training session on body mechanics and proper lifting techniques. Body mechanics. Let's start with the fundamentals. Body mechanics. This is about how you move your body to avoid injury. Body mechanics. The way we position our bodies to perform tasks safely and efficiently. Why it matters. Protects caregivers from injuries, particularly back and shoulder strains. Reduces physical fatigue during caregiving tasks. Enhances care quality by improving movement efficiency. Key benefits. Prevents injuries for both caregivers and clients. Minimizes missed workdays and promotes a healthier workforce. Contributes to long-term career sustainability for direct care workers. Body mechanics basics. 1. Align your body. Keep your back straight. Think of your spine as a stack of blocks. You want to keep them aligned. Bend at your hips and knees, not your waist. Imagine you're doing a squat. Center of gravity. Keep the patient close to your body. This minimizes the effort needed and helps maintain balance. 3. Base of support. A wide stance, about shoulder width apart, provides stability. Think of yourself as a strong, stable pyramid. We are going to go through proper lifting and transfer techniques to ensure your safety and the safety of our patients. This is an essential skill set that will help you provide high-quality care. Let's dive right in. Proper lifting. Proper lifting and transfer techniques are crucial not just for patient safety, but also for your well-being. Incorrect techniques can lead to serious injuries like back strains or muscle tears, which we want to avoid. Assessing the situation. Before any lift or transfer, take a moment to evaluate. 1. Evaluate the patient. Mobility. Check their mobility and strength. Are they cooperative? Can they assist? Explanation. Mobility. Determine if the patient can move independently or with assistance. Can they sit up, stand, or walk? Strength. Assess how much strength they have. Can they support their own weight partially or not at all? Cooperation. Are they mentally alert and able to understand and follow instructions? Will they be able to help you during the move? Even a little bit. 2. Plan the move. Decide on the best approach. Will you need help or equipment? 3. Explanation. Best approach. Based on your assessment of the patient's mobility, strength, and cooperation, decide how to proceed. Should you perform a manual lift, a two-person lift, or use assistive devices? 4. Help or equipment. Determine if you need assistance from another caregiver or if special equipment like a mechanical lift, transfer board, or gait belt is required. This ensures you are prepared and reduces the risk of injury. Using assistive devices. Assistive devices are your friends. They make your job easier and safer. 1. Gait belts. These provide a secure grip around the patient's waist. 2. Transfer boards. Great for sliding a patient from one surface to another. 3. Mechanical lifts. Essential for heavier patients or those with very limited mobility. 4. Slide sheets. Reduce friction, making it easier to reposition patients in bed. Lifting techniques. Now let's get into the nitty-gritty of lifting. Two-person lift. 1. Prepare the patient. Explain what you're going to do. Communication is key. 2. Position the patient. Feet flat on the floor if possible. 3. Lift together. On a count of 3. Both caregivers lift using their legs, not their backs. Remember, you're working as a team. 4. One-person lift. For lighter assistance only. Always use a gait belt and keep your body mechanics in check. Transfer techniques. Transferring patients requires careful steps. Bed to chair transfer. 1. Prepare the patient. Explain the process. 2. Position the wheelchair. close to the bed with wheels locked and armrest removed. 3. Assist the patient. Help them sit up and swing their legs over the bed. 4. Stand and pivot. Using a gait belt, help them stand and pivot towards the chair. 5. Sit down. Lower them gently into the wheelchair. Transferring a partially mobile patient using a gait belt. Scenario: you have a patient, Mrs. Smith, who has partial mobility. She can sit up with assistance and stand with support, but needs help moving from her bed to a wheelchair. Steps to transfer. 1. Prepare the patient. Explain to Mrs. Smith what you're going to do. Mrs. Smith, I'm going to help you move to your wheelchair now. I'll be using a gait belt to assist you. Is that okay? 2. Position the wheelchair. Place the wheelchair close to the bed, lock the wheels, and remove the armrest nearest the bed. 3. Apply the gait belt. Secure the gait belt snugly around Mrs. Smith's waist. 4. Assist to sit up. Help Mrs. Smith to a sitting position on the edge of the bed. Ensure her feet are flat on the floor. 5. Stand and pivot. Stand in front of Mrs. Smith, grasping the gait belt on both sides. On a count of 3, help her to stand using your legs, not your back. Pivot together towards the wheelchair. 6. Sit down. Lower Mrs. Smith gently into the wheelchair, ensuring she is comfortable and secure. Example 1. Answer. The key points in this example are clear communication, proper use of the gait belt, maintaining good body mechanics, and ensuring Mrs. Smith's safety throughout the transfer. By explaining each step, using the gait belt correctly and working smoothly and steadily, you minimize the risk of injury and make the transfer as comfortable as possible for Mrs. Smith. Using a mechanical lift for a non-mobile patient. Scenario: you have a patient, Mr. Johnson, who is non-mobile and requires a full transfer from his bed to a wheelchair using a mechanical lift. Steps to transfer. 1. Prepare the patient. Explain the procedure to Mr. Johnson. Mr. Johnson, we're going to use the lift to transfer you to your wheelchair. This will keep you safe and comfortable. Is that okay with you? 2. Prepare the equipment. Ensure the mechanical lift is functioning correctly and the battery is charged. Place the wheelchair close to the bed, lock the wheels, and remove the armrest nearest the bed. 3. Position the sling. Roll Mr. Johnson to one side and place the sling underneath him. Roll him to the other side to pull the sling through. Make sure the sling is positioned correctly and securely. 4. Attach the sling to the lift. Attach the sling straps to the lift's hooks. Double-check that all straps are secure and properly connected. 5. Lift the patient. Use the control to lift Mr. Johnson slowly, ensuring he is comfortable and secure. Guide the lift towards the wheelchair. 6. Lower into wheelchair. Carefully lower Mr. Johnson into the wheelchair. Ensure he is positioned comfortably and the sling is removed safely. Example 2. Answer. The key points in this example are clear communication, proper use of the mechanical lift, maintaining good body mechanics, and ensuring Mr. Johnson's safety throughout the transfer. By explaining each step, using the mechanical lift correctly, and working smoothly and steadily, you minimize the risk of injury and make the transfer as comfortable as possible for Mr. Johnson. Tips and tricks. Here are some extra tips to make your job easier and safer. 1. Communicate. Always explain what you are doing. This calms the patient and ensures cooperation. 2. Work in teams. Whenever possible, have a second caregiver help you. Teamwork reduces the physical strain on everyone. 3. Stay fit. Keeping your own body strong and flexible helps prevent injuries. Regular exercise and proper body mechanics training are key. Conclusion. Let's summarize the key points. 1. Use proper body mechanics. Straight back, bent knees, wide stance. 2. Assess and plan. Always evaluate the situation and have a plan. 3. Use assistive devices. When in doubt, use the tools available to you. 4. Practice communication and teamwork, essential for safe and effective patient care. Feel free to ask any questions you have. Your safety and the safety of our patients is our top priorities. With these techniques, you're well on your way to providing excellent care at OneWell of Connecticut. Thank you for watching the Body Mechanics and Proper Lifting Techniques module. Please answer the questions for this training before moving on to the next training module.